And by the way, I remember you recovered, like you were almost out of the hospital the first day, I think.
I was ready to go home.
You almost didn't seem like you had surgery when we saw you the first day.
Yeah.
But how was recovery at the second stage? We're pretty aggressive with trying to shape. Not everyone does as much shaping of the body and everything. With the fat grafting and the liposuction. A lot of people probably want to hear it because, they come in asking about the liposuction.
Yeah, that's actually one of the things that I've had a lot of post-op patients say to me was that no one told me this was going to be so bad with like the liposuction part.
Yeah.
So yeah, the first round I think was actually easier than the second round, which I wasn't expecting. I wasn't expecting that because I remember coming to your office for my 1 week follow-up and saying to you after my mastectomy and D-flap, why was this easier than I thought it was going to be? Like, was this surgical skill? Like, is this is it ERAS protocol? Is that how you pronounce it?
Yeah.
That was one of the things you said. And because I did like the immediate, mastectomy with immediate reconstruction, as opposed to expanders.
Yeah.
Round 2 was a little bit different. I think, I'm not one that takes pain medicine a lot. Yeah. So I think I maybe took one Toradol and that was it. But it definitely was more pain for me second time around than the first round. Yeah. But the outcome was good. So
it's worthwhile.
Yeah. What was it? It was mainly the liposuction though, right? The breast and the chest.
Scar revision.
Usually, it doesn't hurt as much as it's more just the liposuction.
Right. Yeah. Okay. And I don't know if that's because, do you do your own nerve grafts? Not nerve grafts, sorry. Nerve blocks.
So we don't do the nerve blocks for those because they can't cover all the places that we do it. Mm-hmm. But we do the tumescent solution we do put in there that has numbing medication. And sometimes, it depends on the cannulas you use to obtain the fat graft. I don't know. At some of the hospitals, we do get lighter local anesthetic. I've had to go in there and change it so they put a higher dose. But you also, in some, like you're small, but some patients, they're going to require 4 or 5 bags, and you don't want to put in all that local anesthetic due to toxicity. So you want to do something that's safe.
Round 1, I had nerve blocks. Yeah. Round 2, I did not.
Yeah.
So I think that made a difference too.
Yeah, because it's hard to block that general area.
Yeah.
With one particular nerve block, but the nerve blocks work well. Like say you flew out the hospital.
I did, and I had 3 C-sections, and this was, in my opinion, and I know this isn't the same for everybody, but for me, it was easier than my C-sections round 1.